The rate of women being diagnosed with lung cancer is on the rise. The American Lung Cancer Association, Lung Force, and CBS Health are uniting lung cancer survivors and their loved ones across the country to defeat lung cancer, the number one cancer killer. Here now to talk about the latest efforts to defeat lung cancer are Dr. Andrea Mckee, medical spokesperson for the American Lung Association, with Adrina Meola, Lung Force volunteer and advocate, dedicated CBS employee. Adrina, why is lung cancer awareness so important?
Well, it's very important because this week is Women's Lung Health Week, and every 5 minutes, a woman is being diagnosed with lung cancer. And then again, it's the number one cancer killer in the U.S. right now, and that's not okay.
Adrina, can you tell us about Lung Force and why you got involved?
Well, I got involved because I've been with CVS for 12 years now. And I'm really proud of CVS for taking tobacco away from their shelves. Also, my mother-in-law, she died from lung cancer, and my mother has recently got diagnosed with COPD, which is a lung disease that has risk factors that turn into lung cancer. So we really want to spread the word about lung awareness.
Thank you. Doctor, what do women need to know about lung cancer and treatment options?
Thanks, Debbie. What we really are trying to message to women right now who may be at high risk for developing lung cancer is that we can now screen for lung cancer, and in so doing detect lung cancer in its very earliest stages. Most women are not aware that lung cancer is actually highly curable when we detect it in its earliest stage. About 90% of the time, an early stage lung cancer can be cured. And that's not something that people are familiar with, because most of the time nowadays, in the absence of screening, people present with really late stage disease, which is treatable but not necessarily curable. So we're at a time in medical history where we can make a significant impact by making sure people know about this new medical intervention to get screened for lung cancer.
Doctor, can you tell us a little bit about the detection methods that are available?
Absolutely. So screening involves a low-dose CT of the chest, which is a low-radiation CT scan that's done every year in women who are over the age of 50 and have at least a 20 to 30 pack-year history of tobacco use. In those women, we have found that we can significantly reduce deaths due to lung cancer by an annual screening. Just like you go in for your annual mammogram, you now go in for an annual low-dose CT of the chest.
Doctor, can you share what key risk factors for lung cancer?
Absolutely. So the two biggest risk factors for lung cancer include age, so over the age of 50, and tobacco use, but also history of radon exposure, secondary smoke, or air pollution also contribute to one's risk of developing lung cancer. COPD, as you recently heard. If you have any questions, go to savedbythescan.org, where you can take a quiz to determine if you're at high risk for lung cancer, and then use that information to prompt a conversation with your doctor.
Doctor, how can others join the effort to defeat lung cancer?
So you can join the effort to defeat lung cancer through wearing turquoise during this week. We're all wearing turquoise to show our pride in Lung Force, which is an incredible campaign that American Lung Association has partnered with CVS Health to try to raise awareness about this number one cancer killer of women. You can check out lung.org, which is a website that has information on how to get involved, and join a walk near you. All over the country there are Lung Force walks where you can participate with your loved ones and family.
Yes.
I go with my family.
Yes.
Adrina goes with hers.
Yes, in honor of my mother-in-law, we go every year, and for the past 5 years. So
Absolutely.
yes.
It's a great way to get involved.
I'd like to thank you both for taking the time this morning to talk with us. Have a good week.
Thank you.
You too, Deb.
Bye.